All right, we're going to go ahead and get started now. Hello, everyone, and welcome to this afternoon's webinar hosted by Online Rewards titled, How Can HR Impact Patient Satisfaction? We have two fantastic speakers lined up for you today. First, a little bit about Online Rewards. We build custom employee recognition programs designed to motivate and engage your staff in a meaningful and consistent manner. I'm Jim Schroeder. I'll be your moderator today. I hope you find today's session informative, enjoyable, and actionable. The duration of the webinar will be 1 hour, and we intend to finish directly at 3 p.m. Eastern. Here's a quick overview of the agenda for today. First, we'll do a couple introductions. We'll get on to linking employee recognition and patient satisfaction and some data surrounding that. And then we'll get into how can we in HR impact patient satisfaction. Then we'll pass it over to Zach and go into some recognition initiatives into a case study of what he's experienced from HR's perspective at his hospital. And then we'll field some questions and answers. So if you think of a question during either of the presentations, please feel free to post it in the question box that you'll see in the bottom right of your interface, and we'll make sure to save them until the end of the two presentations. Now on to the introductions of our speakers. Our first speaker today will be Michael Levy, who is the CEO of Online Rewards. Michael has been instrumental in the delivery of custom programs for over 400 companies and is a respected industry speaker. He's dedicated to helping companies improve employee engagement through the execution of industry-leading employee recognition programs and has helped design programs for clients such as Baycare, Newark Beth Israel, who you'll see a little bit about later on today, Blue Cross Blue Shield, Macy's, and Dell, to name a few. Our second speaker today will be Zachary Lipner. Zach is Vice President of Human Resources at Newark Beth Israel Medical Center, the tallest affiliate in the Barnabas Health System in New Jersey. He holds a bachelor's in Industrial and Labor Relations from Cornell University and a Master of Arts from Montclair State University. Zach began his healthcare career as Director of Food and Nutrition Services for Aramark. He's been at Newark Beth Israel since 1987, serving in various operational management roles. For the last 15 years, he's led the human resource practice in that hospital. So with that, I'm going to now go ahead and pass it over to our first speaker, Michael Levy. Take it away, Michael.
Thanks, Jim. Appreciate it. Hello, everybody. Happy Friday. Appreciate you taking some time out of your schedules. HR is a crazy busy department, especially so these days, so appreciate you taking some time. I'm going to give a bit of background and context. It's not going to be a sales pitch out of Online Rewards, even though I can't help myself as being the quintessential salesperson. I wanted to just share some of our knowledge and expertise and put some industry context into what we're talking about today and how that might affect HR and some of the strategies you're considering. So overall, we're in the big E world. There'll be another word for this in due course, but engagement's the word we're talking about. We're really talking about saying, how do we get people to give their best, in that employer-employee contract. We're asking as the employer for our employees to give the best, and we seem to be using the term engagement as the measurement of are they giving everything that they can. If we get them to give everything that they can, we think we're going to ultimately influence, again in the healthcare context, the work that they're doing, the quality and accuracy of the work, and the experiences that they're creating for patients and patient members. So that's the general topic for today. What is the world of healthcare, HR, and even the world of the employees, nursing professionals like? It's not the same as other industries. We're in the business of building employee engagement programs across industries, but healthcare has some unique attributes to it, and that is it's very demanding emotionally and physically and intellectually. Everything is being thrown at hospitals and healthcare delivery systems these days in some hope that if we throw enough stuff at them, it'll magically kind of solve itself. So there are some things to consider as we go through this. When we talk about how does companies like hospitals nowadays become more profitable, we have to put it into a business context. So let's look at how today's discussion and the operation of the business can be explained in a fairly simplified manner, and why ultimately this discussion around investments in employee engagement becomes relevant. If ultimately we want to, produce revenue and profit, which is where we're at, we've got to influence employee satisfaction. If we influence employee satisfaction, the employees tend to stay. And if they stay, they often and tend to be more productive. Conversely, if they're satisfied employees, they'll put their best effort in. They'll be productive. If they're productive and they stay, then they'll produce value. If they produce value, then the customers, in this case patient and families, will be satisfied. If they're satisfied and they're happy with the services, they'll be loyal. If they're loyal, we drive revenue and growth and profitability. So ultimately, what we're saying to COO, CEO and CFO of the hospitals is saying, these are the things we can influence, right? We can influence the employee satisfaction. If we influence employee satisfaction, these are the things will come from it. And if growth and profitability is the objective, CFO, well, it doesn't just magically happen all of itself because we twiddle numbers on pages. We actually have to get people to do things, the results of which will influence the experiences that patients have, and things flow from that. So if anybody ever needed some data points, again, we're happy to share a copy of this deck. This data is out there, but a survey of over 10,000 employees at 16 different hospitals showed what we all know to be ultimately inherently true, and that is, if there is a high level of engagement, satisfaction, then 90% of the employees will not be looking for a job in the next 12 months. And in the hospital context, especially given the investments required to train and get them set up, the last thing that hospital needs is, turnover rates. And we've seen data that shows some hospitals are experiencing 15 to 25% turnover rates in the first 12 months. So, talk about a financial justification to the CFO, want to reduce that turnover rate. Well, there's ways in which that can be done. Additionally, if you've got engaged, satisfied, participating employees, what about their service delivery? If you've got highly engaged employees, then 65% of the population are going to be giving their best efforts and doing everything that they possibly can to try and deliver the business results that we as employees are asking them for. So that's the high level. Let's now begin to drill in a bit more deeper and say, these are not just any employees. These are hospital employees. These are the nurses and the administrators and the janitorial services and the security and the operations folks, less so in the case of the physicians, not that we wouldn't want to recognize them, but let's focus at least on what we'll call the front line. Why did these people choose this career, in particular the nurses, the majority of it? Two reasons. It's a practical, good choice for a career. Job stability, there's travel, there's relatively speaking fairly good pay, fine. But there's also something else that's probably common amongst all healthcare workers, nurses in particular, and not so much in the case of many other industries, and that is there's an emotional bias that pretty well all nurses, in response to a question that says, do you like to care for people? Is that inherently in your personality? I'm sure overwhelmingly, 95% plus are going to say, of course, that was a big factor in affecting my career choice. So we're talking about emotional people, right? Sensitive people, right? People who aren't just dollars and cents. Let's look at something else, a different perspective. Let's look at the customer view, right, of the healthcare worker, again, in particular the nursing staff. What do we want from them? We want them to be attentive almost exclusively to us as the patient or our family member. We want them to be comforting endlessly. It didn't matter what was happening to the nurse's world. She could have been going through a divorce or some terrible thing happening to some family. Or she just came out of a ward where there was some terrible situation. But it doesn't matter, she's got to be perfectly comforting to me, got to be emotionally sensitive. Right? And of course, know everything about the condition, about the patient, etc. So these are demands that are way and above and beyond most industries, right, and most traditional employees, right? But very much so, in the psyche of a nurse and other healthcare workers. All right, so we've now got this variable that's affecting, us all in the, context of HR and employees in the healthcare space called patient satisfaction. Why is it important? Well, there's some clinical stuff that's interesting, and that is patients satisfied, engaged in their own care, then they're going to complete the prescription. Right? I think there's a lot more data that's going to come out fairly soon that says the patient themselves and their own programming and their immune system is going to have a lot to do with the care. So it's good that the patients are feeling satisfied that they're being cared for, that they're not distressed, that they're not feeling like they're facing a losing battle endlessly. From a business standpoint, if the patient's satisfied, there's the loyalty comment, right? They're not going to doctor shop. They're going to stay with the same hospital, hopefully the same doctor treating the same patient over periods of time tend to deliver statistically a better ultimate medical outcome. That's just some problem. Patient satisfactions are now a imperative. It's an initiative. And Zach, might share some comments on this last point. I think from your perspective, it'll be carry some additional weight.
Yeah, thanks, Michael. Value-based purchasing, publicly reported scorecards like Leapfrog and CMS, all over the news these days. Value-based purchasing is affecting our bottom line revenue. So patient satisfaction is more important than ever. It's driving business our way. It is affecting our bottom lines. If we want to talk about the ROI around recognition programs, just think through how much money is on the table with value-based purchasing over the next 5 and 10 years as it expands into the emergency departments, as it expands into other areas of hospitals, outpatient surgery and the like. Patients being more astute about choices and using these publicly reported scorecards and star systems, and they are becoming more and more heavily weighted around consumer assessment surveys such as HCAHPS. And to go back to your number one point on this slide, Michael, this idea about satisfied patients tending to comply with prescribed medical treatments. When we think about healthcare disparities in the United States, one of the reasons that we have such healthcare disparities is specifically because of patients' engagement and relationships with healthcare workers. We see it around language, we see it around other aspects of culture, and when we can relate to people in ways that are meaningful and heartfelt, then we will find that we get better traction around compliance. And as we move into a population health model, compliance with our recommendations is what is going to reduce readmissions, drive down our costs, so that we can really be winners in the population health world. So as healthcare changes, we need to understand how patient satisfaction is affecting not only our business, not only our reimbursements, not only our bottom line revenue, but also improving population health.
Good points. Thanks for sharing some of those additions. So we then now face the question, how do you influence that? Because I think at the C-suite level in all hospitals, healthcare delivery systems, this question now is, well, how do you influence it? Well, let's look at the options. If you're the business, owner of the hospital, you could build more buildings or improve the buildings or add wings, as the case may be. Fine. Facilities investments. We could do capital equipment, new MRI machines, new various other machines, new bedding. Certainly all reasonable. We could do food and bev. That's part of the experience for the user. Certainly relevant. Or we could build it into services. Let's add new services for the organization. Or we could do it in staff. All right? So they're the questions that, as the C-suite look at this, they've got to say, if I'm trying to do patient satisfaction results, what am I going to invest in? So we can shed some light on this question. Right? The studies are unequivocal. It's knowledgeable. It's common knowledge anyway, but if they need the data point, the studies are going to say that staff care is the most influential attribute to patients in rating their overall hospital experience as excellent. Right? So it's all about the experiences that the patient is having, and the most influential experiences are the human-to-human interactions that they're having. Granted, they're aware of the food they're eating, the bed that they're lying on, the paint on the walls, the stage of the hospital overall. But we have all had those experiences outside the hospital space where there may be some issue or limitation. There was a problem with the plane, the hotel room wasn't right, the people next door, the food came cold. But if those people that we were dealing with in addressing our concern addressed us, right, and focused on us, we tend to walk away from those experiences with a sense of satisfaction. The same applies here. Fine. So we said we're going to invest in staff. What do we do with staff? We could increase headcount. So we'll have more people, doing work. Certainly, that's relevant. We could increase their wages and benefits. So if we pay them more, fine. But everybody knows that wages and benefits increases are a very difficult thing to argue, partly because it's expensive, relatively, partly because when you provide a wage and benefit in 2016, well, you better do it again 2017, 2018, 2019, and the cumulative effect makes it much more expensive when you consider it over time frames. And it's very hard to take them away, as we all know. Once you've given it, that's it.
Interrupt for a second, Michael. I have never seen a good study that shows that increasing wages improves employee engagement. I've just never seen one. Every employee will tell you that it does, but I've never seen one that shows that it actually does.
So we can invest in training, and certainly we should invest in training, because if they're better skilled and they're better capable, then they're able to better deliver, the outcomes. We can deliver and invest in facilities for our staff so that so that staff have a better experience day to day in the work. Yes, that's also relevant. But we might also consider engagement and recognition as an investment category. So when we consider that 55% of employees reported that management's recognition of their job performance was very important in their, sense of satisfaction, and that recognition can be minimal or potentially, depending on the hospital's current programs and work in this area, could be cost neutral, but that it impacts the culture of the organization, it impacts the turnover and tenure, it impacts attendance rates, it impacts productivity, it impacts the engagement, and from that we impact patient satisfaction. We are making the business case, or trying to equip you to make the business case, that says we have to be doing well in this area of recognition in order to influence engagement and affect the patient satisfaction scores. And it is quick to do and inexpensive relative to all the other investment costs. We could do nothing, and that's fine, because many organizations get stuck in doing nothing and hope the results will just magically change. But if we're going to do something, it then becomes the question of, well, where do we apply our resources and efforts to, and which produces the best results? So let's see with some real world examples of what happens if you put together some type of, recognition intervention in a hospital environment. This study showed we can get a 97% decrease in medical record errors. I'd say that would be meaningful. We could get a 76% decrease in ER registration errors. Pretty meaningful. 11% increase in EKG procedures accomplished. And so forth. I'll let you read that. And that's, again, one particular study, and none of us know the circumstances for certain as to what was going on in that hospital at the time. But inherently, we all know, partly because we're HR, but partly because it's obvious, that if you actually can create a sense of appreciation in a human being for work and efforts that they do, they will continue to do that behavior. And these recognition programs are all designed around that. There are behaviors, population, we want you to do. And if you do those things, we want to celebrate you for doing them. And we want to remind you of how important that is. And they can become then self-fulfilling. $11 billion are lost every year due to turnover. It's a big number. 17% of nurses leave their jobs within the first year. Again, from hospital to hospital, that will change. But the total cost justification for making a fairly significant commitment to developing a positive culture of recognition is in that second data point. And then if you have companies with a good focus around recognition, you've got a 31% reduced turnover rate. And again, data to data, but if we look at Gallup, those hospitals with engaged employees score 10% higher on their HCAP surveys. So we all know that the data's out there. All right, so what are most hospitals, and it's not unique to hospitals, in other businesses too, but we find it in many of the hospitals we come across. What are they doing? They got a years of service program. They got an employee of the month program. They do holiday parties. Some of them do summer picnics or dinners. They celebrate birthdays. They do retirement parties. They're bringing all these things together, but The question is, when was the last time they looked at refreshing or updating them? And how do those various tactical initiatives actually play out to the perception of the employee? In many situations, we feel we're coming into an environment where the creators of these various programs, they think they're doing the best thing ever. It's the best birthday party program that exists in any company. We've got our employee of the month thing. It's the best thing, Adam. We've got an anniversary program, and we send them things, and they get a little catalog, and they choose a prize. They think that's the thing. But is anybody really looking at that from the perception of the employees? Because it's all about their perception. It's not about whether we in HR think that we're doing a good job for them. It's what do they think about that, and is that relevant to them? And does it deliver a consistent message around what are the values of the hospital, and what are they looking for us to do, and are they appreciating me for doing it? So what we often find is the programs are there. Companies are doing a years of service, length of service, and above and beyond performance recognition. Maybe there's some behavioral sort of reward programs, health, well-being, safety, possibly a peer-to-peer program, maybe a retirement program. The challenge becomes, are they all separate programs? Are they all put together by different committees? Are they all run from different sort of parts of the organization? Is there a handbook? Have you got a handbook for the program so that the employee, when they're on board, they learn about all things? They say, oh, by the way, we've got about 8 different kind of programs that we also do for you, but here's the handbook for them so that you should know where they all are. We're saying that's not necessarily the right way to create the impression that we really want. Right? What are we really trying to do? What we really want the employee to perceive or see or feel is that all these things we do for them as an employer all interconnect and all carry and convey a consistency in message that says, you are an employee of our company and we are glad you chose to work with us. And we are asking you to give the best that you can in as many areas that you can to help us deliver on the mission, in this case in healthcare, on helping patients with their health condition and situation. And so we've created these programs, and they're all created for you. And it all is around our business objectives and our values and our mission, and we're all trying to create a great culture together. That's what we see, and that's what we know will produce the biggest returns for companies that are investing in these recognition rewards programs. Right? And the opportunities that we find in most hospitals when we say something can be either cost-effective, meaning it's not very expensive, or cost-neutral, that is just to even look at how the programs that they currently have are all set up and how they can all align together to produce a business outcome. So that was the introduction. Thanks for the opportunity. I'll stop talking. Zach, I'll pass it to you.
Thanks, Michael. Zach, it's over to you now.
Okay, great. Thanks, Jim. I wanted to spend a little time talking a little bit about our experience here as well as our program. Not saying that it is the ultimate program, but a program, and hopefully spark some ideas so that our participants can think about how they might change their reward and recognition programs in order to help with employee engagement. And that's what it's really all about, is this idea of employee engagement. The advisory board, which is a highly reputable organization working in this space in healthcare, defines employee engagement as the amount of discretionary effort that employees bring to the job every day. Let's face it, every employee needs to provide some effort. If you provide no effort, you won't last long in our organizations, and there's probably a minimal amount of effort that everyone must contribute. But what we really need out of our workforce is discretionary effort. We, hear that expression over and above, people who go above and beyond. Who are these people? And what it is about them that makes them give us that extra effort? And how can we as leaders get more discretionary effort out of all of our employees? The ones who are giving us discretionary effort, the ones who are giving us a minimum amount of discretionary effort, the ones who are perhaps ambivalent when it comes to discretionary effort, and how do we increase that? I think we do it by providing inspiration through leadership. That's what we do as leaders in organizations. Today's model, we no longer direct the workforce the way we think of it. When I started in management 35 years ago, we understand leadership is about inspiration. It is about empowerment. It is about getting everyone in the organization to work and row in the same direction so that we can achieve great results with what are really shrinking workforces and shrinking dollars in the healthcare system. How do we go about getting that loyal and emotionally committed workforce in our organization? So we obviously have to spend some time thinking about this from a culture of recognition perspective. So the first point I want to make here is that it is about recognition, not just reward. I mentioned earlier that employees will tell you, well, if you give me more reward, I will give you more discretionary effort, I will work harder, I will do more. But I think we all understand as leaders that recognition is really what motivates people. We need to have the reward too, because if we don't have the reward, then we were not going to change our culture. So we have to somehow create a hybrid of reward and recognition, but sometimes all we need to do is recognition, and sometimes we need to do reward, and sometimes we need to do both, and there are moments where that comes into play. Now, in order to do this, the first thing that I believe we need to have is a destination for recognition. I got into this space many years ago, trying to pull together a whole bunch of disparate programs in our organization around recognition. Are we rowing in the same direction in our recognition programs? Do people know where to go to give recognition? Do people know where to go to see who is being recognized? Because seeing who's recognized, as we're going to talk about in a second, really is part of this inspirational message. And how do we get this word out to our workforce that is 24/7, some people just working weekends, people working nights who we never get to touch? How do we get them on board with our programs? So we're going to create a destination for recognition. We have to brand it. We have to make it fun. We have to make it someplace that people want to go. If it's simply passive, a place where this is a repository of information, but there's no fun, there's no reason to go there, there's no reason to look at it, there's no reason to integrate our programs and see them all coming together, then we're not going to create this destination for recognition. We need to keep it on target. We need to keep it fresh, and we need to think about what we need to do in our organizations on a year-over-year basis, and how do we tweak these programs to help us achieve our goals, which are changing, and the expectations about us that are changing. So we need to certainly keep it on target. And lastly, as I've said earlier, we need to tell these stories. I am sure that everyone on this call has great stories in the organization. People who do heroic things, lives we save, lives we touch, dignity at the end of life, employees supporting employees. How do we tell these stories in a way where everybody gets to see them, pull the organization together in a way that makes people want to give more discretionary effort? So I have 5 categories of recognition and reward that I tend to think of as part of this culture. These are the 5 achievement awards, peer-to-peer recognition, discretionary awards, excellent awards, and organizational accomplishments. This is just the way I tend to think about how we do recognition, but each of these has a specific goal in mind, a specific target population in mind, and a specific behavior that we are trying to change or recognize and reward. So we'll go through them. But I think that the most effective programs, we're going to have this destination, need to pull all of these things together in one place. So when you sign on to our reward and recognition program here at Barnabas Health, Newark, Beth Israel, and it's branded under our program, Beth Bucks, and it's been around for about 12 years, and it's part of the culture here. Everybody knows Beth Bucks. We used to give out a bunch of cash compensation. Nobody expects cash compensation for reward and recognition. Everybody knows you're going to get bucks. They're going to go into your account. You can spend them. You can bank them. However you want to treat them. but it does create those intrinsic rewards as opposed to cash compensation. And you know, Michael, maybe you want to talk a little bit later on after I finish about the difference between cash compensation and intrinsic rewards. So we have a little mission statement here, and we have a scorecard. So the first thing you see on the top, that department scorecard, is each department has a department indicator, one goal that they are working on during the year, and we track their performance quarter over quarter, make it public to everyone in that department, and then we're going to drive some reward off of that scorecard. But this is a way to communicate, this is the goal for this year for your department, and we may have 80 or 90 different goals across the 80 or 90 different departments at the hospital. We'll look at the high five awards. We'll look at the success stories. Again, this is about telling the story and providing that inspirational leadership and creating a destination for recognition. So the first one we'll talk about here are achievement awards. Whether these are anniversaries, perfect attendance, we used to give out stuff for these. This is one that we have moved solely into the world of recognition and out of the reward space. You get rewarded for attendance by showing up. You get paid. We appreciate people who have been with us a long time. We have a big party, but we don't give any individual reward around recognition. But on the other hand, we can never ignore it. I try to visit every employee who celebrates a 25th, a 30th, a 35th, a 40th, a 45th, a 50th anniversary. We actually have 3 employees in our workforce who have been with us more than 50 years. And I try to visit them on their anniversary. When I go to visit them and I say to them, do you know what today is? They all say to me, yes, I started working here 25 years ago. So they know it's coming. So how do we make sure we don't miss these opportunities? Because when we as leaders miss them, we are just dead in the water. So we feed hire dates over to our vendor here, and it gets published for everybody to see. And people can even comment on it and send high fives, which we'll talk about in a minute. But we also send an email to the manager. In 7 days, this employee will be celebrating their 21st, 22nd, 23rd. Please recognize the day in your department. When we miss these, I got to tell you, we are just out of luck. It is an opportunity that we never get back, and employees know these days, and we need to recognize them. We don't necessarily need to reward them, but we need to recognize them. Now, the next category is this peer-to-peer concept, and I've spent a lot of time over the last few years trying to understand how do we encourage people to get, or informal leaders, employees, to get their peers to perform higher. So we really have wrapped our arms around this idea of high five awards that any employee can send to anyone else, simply to say, you did a great job, we want to recognize you. I kind of think of it the same way I think of a baseball team standing in the dugout applauding the batter or the guy who stole a base or the person who hit a home run, the basketball team cheering each other on. Yes, the coach does recognition, the general manager signs him to a new contract, but in the course of the game, on a day-to-day basis, it is the applause that comes from their teammates, the rooting and cheering that comes from their teammates and fans that really improves the performance of that team. We know it happens in sports all the time. We can bring that to the workplace through a peer-to-peer recognition program. And this helps to drive accountability. There's lots of articles out there about driving peer-to-peer accountability. How do peers hold each other accountable? And we need to do more and more of that. We have less and less management presence in our workplaces. We're not taking the cuts out of the bedside, so we're taking it out of the management ranks. So how do we get our performance to improve when there are less and less managers present in the workplace? Peer-to-peer can do that. If peers struggle with holding each other accountable, they certainly should not struggle with recognizing each other and using recognition to drive performance. And when employees send high fives to each other, then we want to make it some fun. So they get some tokens and they get to play our games. So we've had spin and win games. This year we're running A slot machine. Now, this is New Jersey. Gambling is very important to our economy, I guess. So why not? Yes, it's rigged. Yes, it's game to pay out a certain amount, but employees do win points, and they do use those points to, buy stuff that's cheap or save up for TVs and iPads. And every time they turn on that TV, every time they turn on that iPad, my manager gave me this, my peers gave me this, my organization gave me this. The value of intrinsic rewards just far exceeds the value of cash compensation, in my opinion, when it comes to reward and recognition. And we want to publish them. We want to tell the stories. We want everybody to see them. One good deed brings on another good deed. If I see one that somebody said, maybe it will motivate me. And we see over 1,000 of these per month going on across our organization. Very easy to do. You go in, you pick out a category, you pick out a winner. If you're a manager, you can assign some points, so you can do some reward there. We allow our employees to nominate for points. So if an employee sends a high five to another employee, but they think what they did is worthy of getting actually some reward, push email goes out to the managers. The manager can click on it and send some points. But it really is the stories, the reason behind the rewards that I think drive the change in behavior and pull the organization up all at once. And here's a way we tell that story through our Excellence Awards. These are our individual awards that go out to people, whether it's a DAISY Award, which is a national foundation, or our Internal Core Value Awards. Our Excellence Awards do have that reward attached to it because these are the true superstars of our organization. They feel good when they get something, but more importantly, it gives us the opportunity to tell some incredible stories about incredible employees, changing lives, changing healthcare outcomes, providing dignity to time of death, providing great healthcare, providing great quality, providing great patient safety, and really helping the organization to achieve its goals and aims. But as you know, I think I've said this at least 5 or 6 times, so here it is in bold, underlined. Make sure you tell the stories. We need to get our stories out there, and it's harder and harder with today's workforce. So having a destination for recognition is so important. I mentioned our scorecards earlier. This is how we recognize collective success. This is how we recognize this is how we get the focus, the cohesiveness, so that everyone is rowing in the same direction around the goal. Last year, we were focused heavily on improving patient satisfaction. So we put patient satisfaction up here as department goals, and we saw great improvements in our patient satisfaction scores, really getting out of some real value-based purchasing and moving towards a place where we can actually get some dollars out of value-based purchasing. And while there are many things we've done organizationally to do this, from tweaking staff levels to putting other support mechanisms in place, I'm the HR guy, so I'm invested in reward and recognition. And I think if we tell people how we're doing, people will do a better job. And if we can create some reward around that, people will do an even better job. So how do we create reward around this? We do it with our Superstars events. Quarterly, we run an event where we give away a whole bunch of stuff. But in terms of our scorecard, if a department achieves its goals in that quarter, then that department is entered. Everyone in that department is entered in a drawing for everything from movie tickets to massages to points in our system. And we also give away a 55-inch television set. And I can just imagine that employee turning on that television set and going, boy, my team helped me to do this. I won the raffle, but it really gets us some great recognition around our goals to get everybody headed in the same direction. And these events are so popular in our organization that we're streaming them live onto the floors so that everybody can watch them go on and participate and, hope that your name is the one that is pulled out of the hat. Unfortunately, my name just never is, but I'm working on that one. So I think that kind of wraps up the programs I wanted to talk about today. And I'll kick it back over to Jim, and we'll move on.
Great. Excellent. Thanks to Zach, and thanks to Michael for both of your informative presentations. As I said at the beginning, we do have some time at the end for some questions and answers from audience members. So we've had a few questions come in already, but if anybody thinks of a question on either of the presentations during this session, please enter the question into the question box on the bottom right hand section of the interface. So the first question I'd like to read off that I think this will probably be directed to Zach. It's specific to his portion of the presentation, is from Tori, and the question is, how is recognition impacting outcomes at the hospital?
That's a great question. You know, connecting the dots between what affects outcomes, what programs we put in place and what affects outcomes is just so hard to do. There are just so many things going on, and the complexity of our systems and the complexity of our care is such that I think in our business it is really, really hard to have evidence that ties one to the other. I think we have to have, first of all, a belief that recognition is important, that reward is part of recognition, that these are dollars well spent and actually less dollars than the other things that people think about that improve outcomes, adding more staff, adding more wages, changing the way work systems work. These are relatively inexpensive programs, but I don't know how we can tie them to outcomes per se. I can say, look, you know, I put in a whole bunch of programs around patient satisfaction, one of which was a focus with our scorecard, and our patient satisfaction scores improved. Can I isolate it to the program? No, I can't. But collectively, it is part of the fabric, part of the culture, part of what drives performance. I hope I got that one. That's not an easy one to tie together.
Yeah. This next question from George, I'll put it out there to both of you. How did this, more specifically to Zach, but Michael might have some comments on this too. How did you get executive leadership behind it?
It took some time. So let me tell you my own journey, just so to kind of put that out there. We had an Employee of the Month program. We were giving away American Express gift checks. I gave someone to an employee who'd been here 20 years. I saw her a month later. I said, Mary Ellen, what did you do with the American Express gift check I gave you? And she said, I sent it to my son to pay his phone bill in college. And I just said, boy, you know, she's just not reaping the benefits of the, you know, $150 we gave her. That was for her. It wasn't for her kid to pay his phone bill in college. So I tell that story. But I think that the overall message that I send when I talk about these programs is, when you ask employees, what would you like in terms of reward, they all say cash compensation. Only a fool would not say cash compensation. But at the end of the day, this is our money. We decide how to distribute it. And if we decide to distribute it through a recognition program, such as our Beth Bucks program, as opposed to giving cash compensation, that's up to us. And it takes some change. It takes some culture change. It takes some working on senior leadership. And I had a chief human resource officer in our healthcare system who it took, even after I put the program in place, it took years to convince him. And how did I convince him? Because I had it in my hospital. And then the hospital down the block, which was one of our, you know, affiliates, said, why can't we have this? And then they converted to the program. And then another hospital in our system said, why can't we have this? And then they converted to the program. So it actually became a groundswell amongst employees who heard about it in our affiliate that actually changed culture in other affiliates.
So let me add some additional perspective to, you know, Zach's comments. So to the question of how to get buy-in and support. So firstly, it's a process and it's a journey. And it's not a journey whereby you're currently not doing anything in your hospitals and thus all of a sudden we're about to do a U-turn or create some new initiative. The first thing we are seeing when we come into, again, many hospitals, but other industries too, is to say, you're doing these things, but they're disjointed and ad hoc, and we're crossing over from different committee groups, and potentially there's some silos going on. We need to break those all down. We need to have a common framework within which all these programs can still exist, because it's not about necessarily doing away with anything that you're currently doing, but if you got to redo them all again, right, for launching 2017, you would keep some of the ones that you're doing, right, and maybe challenge yourself to how are you executing and can you improve on the execution. You might do away with a few that don't seem to really make much sense, and then you might learn for some best practices on what else is being done, and you relaunch them. So we're not trying to change executive leadership. We're trying to say, executive leadership, we're going to reduce our expenditure and increase our results. How's that sound like a strategy? And of course, every CFO is going to go, great, that's exactly what I want. How are you going to do that? And so then the discussion. Now, that's the first point. The second point is the journey of how do you begin to build some groundswell support. When members of the executive committee or those that are in charge in certain hospital situations may be from a period of time in which people were lucky to have jobs, and it wasn't that there wasn't a period in time in history, and it wasn't even that long ago when people were lucky to have jobs. But that's not what the current climate is. Not only is it that they got, job options, particularly in the healthcare space, but they're actually being hounded and headhunted, right? So we have to make the case that says, look, whatever your personal views might be, one must begin to meet the population at where they're at. And you didn't grow up with Facebook, did you? And the answer is no, the executive says. Well, guess what? Right? 60% of our employees spend X% of their personal time in this world where they're sharing and recognizing and collaborating and commenting and participating in these digital worlds. We need to have our own, but we shouldn't leave it like ad hoc, like it's just some kind of thing that you go out to. No, we're going to control it and align with some of the messaging and our vision and values and begin to sell this sort of story. Now, you've got to find an executive who's willing to buy into it, because if within the first 60 seconds of the conversation, the person's going, I don't believe in that. Don't worry. You're never going to convince the person. It wouldn't matter what piece of fact or information you provided. You have to find your executive partner first. Who am I going to get some leadership support? And then, in conjunction with that person, begin to make the business case and begin to develop the arguments and begin to say our people are important and our people respond to these things and they're emotionally programmed. We're all human beings. We need to do things. Some of the things we're doing, we could do it better. Give me some support and resources. And let me try break down the silos, right, between these various programs. Let me align the programs. Let me create some identity. And to the end of it, to the point where Zach was commenting on whether it's cash and whether it's prizes and whether it's a game and whether it's points, and if you called it best pucks or you just had it points you did, those things are actually all secondary. They're all executional questions, right? As a both the vendor and somebody in expertise, look, the big be-all and end-all is not whether you gave them a cash card at the end of it, or you did it in payroll, or you did it with a gift card, or you did it with, whatever, a coffee set, or you did it even with a little brooch and a pin with a thing that says congratulations. They're the secondary part of the experience. Note Zach's comment, 1,000 peer-to-peer recognitions a month, right? Non-monetary, so there's no cost, and 1,000 people are saying thanks to each other. So how do we put a value to that? If we said somebody spending some time and taking a few moments to show and express appreciation to another employee that has an influence on that employee, that if they got 4 or 5 of them in a given month would begin to get a sense of appreciation, we could just put up a value. We'll call it $5. That means Zach's getting $5,000 a month of free HR leverage. Right? That's how I would begin to sort of position it, because what we're sort of trying to share in this conversation is how you tactically execute it is going to vary. Right? Zach's execution at Barnabas Health is the way that Zach has influenced in conjunction with his team and considering the history of Barnabas and what it had done. It's different to our other hospital clients. They're doing it differently. So I think again, sorry, I don't mean to be lecturing. The first point was that it is about education to begin to build leadership support, but you've got to find an executive leader who already inherently believes that people make the difference in the healthcare system, and that if we can affect the people, we can affect the patient satisfaction. Starts with that. Then the second part is that person a big enough leader and got enough weight to help sort of break down some of the silos that have formed as a result of these programs being created. You've got a wellness program over here in the benefits department. You've got something for years of service that may have been benefits or comps, and some group does it with some vendor relationship over there. You've got some discretionary stuff happening. You've got some employees in the month. Maybe there's a patient feedback loop that's happening. Those things need to come together, right? And they certainly need to come together under an HR leadership so that HR can begin to control it. Still working with these people. And then once you get to that point, you can then decide whether there's cash or prizes, or what we'll say is there's a role for all of it, you know, because they all have a corresponding effect and influence on the outcome. But don't get caught up with what the reward is. That's secondary. The primary is, as Zach said, everybody at Barnabas knows what the Best Bucks program is. That's huge. People are using it. There's 1,000 recognitions taking place per month, non-monetary. That's huge. There's a place where people can go to and see the service anniversaries and make sure everybody gets patted on the back and given a high five, right, for being 5 years or 10 years or 3 years or 17 years or 26, because that's what people want. They don't want the catalog with the prize that says, here, you get a toaster. Thanks for being with us for 10 years. Here's a $19.99 toaster. There, you know, sometimes you can create worse by doing it, right? And again, we're not opposed to giving things away. We think there's a role for it, but it's about bringing it all together to create the meaning. So that was a very long-winded way to get quite a few points across. So hopefully some of those were helpful. Back to you, Jim.
Sure. Thanks, Michael. We've received a couple questions asking about getting a copy of the slides. I wanted to let everyone know I will send out a follow-up email with a link to an on-demand version of the webinar, so you can watch it again. And with that, I think we'll go ahead and finish up, as our time is nearly up for the day. And any questions that you may have that were not answered, I'll make sure to get those responded to via email. On behalf of Online Rewards, I want to thank everyone for taking time out of their busy calendars for attending today, and I hope that you found the content both informative and actionable. Please feel free to contact us with any other questions that you may have coming out of today's session. I hope everyone has a very successful second half of 2016, and want to thank you for your attendance today.